Lymphoseek is a radiopharmaceutical agent specifically engineered to exhibit properties that enhance lymphatic mapping for sentinel lymph node detection in clinically node-negative breast cancer, melanoma, and squamous cell carcinoma of the oral cavity. Lymphoseek differs from other FDA-approved radiopharmaceuticals and dyes for lymphatic mapping, as it is approved for intradermal route of administration in addition to subcutaneous, subareolar, and peritumoral routes. The purpose of this video is to provide education on the administration of Lymphoseek, and specifically the intradermal injection technique. First, let's look at dosing information for Lymphoseek. The recommended dose of Lymphoseek is 18.5 megabecquerels, or 0.5 millicuries of radioactivity, and 50 micrograms as a mass dose for surgery, between 15 minutes to 15 hours after injection. Lymphoseek is an agent with a low volume of administration. Lymphoseek may be administered as a single injection of 0.1 to 0.5 milliliters, or as multiple injections of 0.1 to 0.5 milliliters each. The total volume administered can be up to 1 milliliter in multiple syringes. Lymphoseek is a radioactive drug and should be prepared and handled with appropriate safety measures, including effective gloves and shielding to minimize radiation exposure. Radiopharmaceuticals should be used by or under the control of physicians who are qualified, experienced, and licensed by the appropriate governmental agency in the safe use of radionuclides. Concomitant administration of local anesthetics with Lymphoseek is not recommended and may impair lymph node mapping. In animal studies, locally injected anesthetics have been reported to reduce lymphatic flow. Less than 1% of patients experienced injection site irritation and/or pain in 3 well-controlled studies. Next, let's discuss how to administer Lymphoseek. Lymphoseek has 4 approved routes of administration, including intradermal, subareolar, peritumoral, and subcutaneous injection. This video will illustrate intradermal injection, since this was the most commonly used injection technique in the Lymphoseek Phase 3 clinical trials. To administer an intradermal injection, first pull the skin around the injection site so that the skin is tight. Next, insert the needle at a slight angle between 5 to 15 degrees from the skin surface with the bevel up. The bevel should be just below the epidermis. As you slowly inject Lymphoseek, you will see the formation of a wheal on the skin surface. If you do not see the formation of a wheal, the injection has gone too deep. Once all the dose has been administered, remove the needle from the injection site and gently apply pressure with a gauze pad. The intradermal technique described is applicable for use on both breast and melanoma cases, and for other tumor types for which lymphatic mapping after an intradermal injection is a component of intraoperative management. Once injected, Lymphoseek enables rapid transit from the injection site and accumulation in the first echelon lymph nodes. It is recommended that lymphatic mapping and sentinel lymph node biopsy with Lymphoseek are conducted between 15 minutes and 15 hours post-injection. In clinical studies, Lymphoseek was detectable in the lymph nodes within 10 minutes and up to 30 hours after injection. In clinical studies, lymphoscintigraphy was performed as early as immediately after injection and up to 21 hours. Now let's look at 2 actual patient case studies that utilized intradermal injections with Lymphoseek. We will begin with a breast cancer case. The first patient is a 77-year-old female with invasive lobular carcinoma of the left breast. The patient received 1 intradermal injection of 0.2 milliliters of Lymphoseek in the intradermal periareolar area. No local anesthetic or blue dye was used. 2 axillary lymph nodes were visualized within 30 minutes post-injection. Intraoperatively, 2 pathology-negative sentinel nodes were identified within the left axilla. Now let's look at a melanoma case study that utilized intradermal injections with Lymphoseek. The patient is a 51-year-old male with malignant melanoma on the left mid-back. The patient received 4 intradermal injections of 0.1 milliliters per syringe around the site. There was no use of blue dye or local anesthetics. The preoperative lymphoscintigraphy obtained planar posterior dynamic images and static planar spot images. 2 left axillary and 2 right axillary sentinel nodes were identified with imaging. Intraoperatively, 2 sentinel lymph nodes in the right axilla and 3 sentinel lymph nodes in the left axilla were identified. 1 pathology-positive node was found in both the left and right axilla. These patient case studies provide real-life examples of intradermal administration of Lymphoseek in breast cancer and melanoma cases. Additional educational and technical support for the use of Lymphoseek is available through the Cardinal Health Medical Affairs team. For medical drug information, please contact the Cardinal Health MDI hotline at 800-476-5270 or email npsmedicalinfo@cardinalhealth.com.